Most of the AI we discuss is supervised. As we discussed in an earlier episode, that's the idea of showing a computer a chest x-ray, telling it this is pneumonia, and it learns from that supervising signal. But what if we don't know the diagnosis? What if we're staring at a massive database of patient records and just want to see if there are patterns that we've missed? This is unsupervised learning, as discussed in the previous episodes a few months ago, and the workhorse algorithm here is called k-means clustering. Think of k-means as sorting a chaotic pile of patient notes into distinct stacks based upon similarity without reading the diagnosis. You tell the algorithm, I want you to find me 3 distinct groups of patients within this data. That 3 is the k. The algorithm drops 3 data points, called centroids, into the dataset. It grabs the patient data closest to each point, then it calculates the average of that group, and then moves the center. It repeats this process, shuffling the groups until it has mathematically defined 3 distinct cohorts of patients who are similar to one another and different from the rest. It doesn't know what connects them, it just knows they belong together. This is revolutionizing how we can think about defining disease, specifically in precision medicine. We used to think of sepsis or diabetes as monolithic conditions. But using clustering, researchers are feeding patient data into these algorithms and discovering distinct phenotypes. For example, k-means might find a cluster of sepsis patients who respond well to fluids, and another cluster who die if you give them fluids. One of the weaknesses of k-means clustering is that you have to dictate to the algorithm how many clusters, the k value that you want it to look for. If you ask for 3 groups, it will find 3, even if there's naturally 5. It requires human judgment to interpret the results. So the bottom line, k-means isn't for diagnosing a single patient, but it's for discovering new types of patients and patterns within data. It helps us to treat the phenotype, not just the ICD-10 code. So that's k-means clustering in a nutshell.